We have the largest bus system in the U.S. You'd never know that because in Los Angeles we never get out of our cars. So we do have 21,000 miles of roadway in the county. So over 1/3 of our population is foreign-born. We have the second largest population of foreign-born citizens in the country, the largest being Miami. And the majority of our population speak another language than English in the home. And there are over 200 different languages spoken in Los Angeles County alone. 1/3 of our population are surmised to be non-citizens. We translate at the health department our materials into at least 11 languages. So as you can tell, we're incredibly diverse and complicated. So the government structure, there's one county, 88 cities, 83 school districts, there's 63 law and fire agencies, and boy are those guys tough to get to work together, as well as over 100 special districts such as water districts, mosquito abatement districts, and there are 2 other health departments in Los Angeles County, which is Long Beach and Pasadena. So we have a 5-member board of supervisors with executive and legislative powers. So that's yet another layer of government, in the county. The sheriff, the district attorney, and the tax assessor are separately elected. We have a $21 billion annual budget, which is larger than 42 states, and the majority of that funding comes from state and federal sources. The county employs 91,000 employees, making us the largest employer in the county, public or private. We run the health and welfare and criminal justice systems. So now in our little Department of Public Health, which is going to oversee a potential pandemic, our annual budget is $750 million. We have 4,000 employees, and we have a wide range of services and regulatory responsibilities. We have the Communicable Disease Control Unit, as well as a BSL-3 Public Health Laboratory. We have chronic disease control, health assessment and epidemiology, child and maternal health, and specialized programs such as HIV and alcohol and drug. And we also have an environmental branch that runs a radiation program and does all the inspections of the different health facilities and restaurants. Plus there are 5, out of those 104 hospitals, 5 of them are county hospitals. So we have some natural partners that we work with and that we have been working with all along. OEM, Office of Emergency Management, as well as EMS, Emergency Medical Services, our other health departments, and the city. The city of Los Angeles is the largest city, but it is yet one of the 88 in the county, as well as working with Los Angeles Unified School District, which is one of those many school districts, but that is the largest. We also work with the FBI. There are 16 of us in the health department who have security clearance, and we work with them as their medical advisors, because they really don't have a lot of expertise in that. So that's actually been a very interesting development, working with them and being able to maybe lend some reality-based investigations to that. As well as working with, I don't know if you've heard of BENS, it's the Business Executives for National Security, and that's for a good partnership in that they work with the larger corporations throughout the country and the county, trying to help governments with some of their shortfalls. So due to how complex we are, we have to have partnerships. However, you need to be able to be, nimble and adaptive to get things to go. And, in government, sometimes that's not a natural thing that happens. Things take a long time in the government. Preparedness has a cost and it needs a sustained effort. The pandemic influenza funding that we have is year to year. So that's hard to sustain projects when you're only looking a year down the road, and sometimes the guidance doesn't come out in time. So currently, what we're working on was not approved until January, and yet everything that we need to do, we have to finish by August or we lose our funding. So it's kind of tricky. Also this year in California, there's a $14 billion budget deficit. So the first things that will be cut, already they've started cutting education, and the next thing will be the health department. As well as working in the government, there's the usual administrative stuff. Government employees get paid less, it's harder to get people, it's harder to get office space, things like that. So we take it back to the basics. If you're going to prepare for a pandemic, you need to look at seasonal influenza. Unless you're prepared for seasonal flu, how could you possibly be prepared for a potential pandemic? And also in doing that, that would make you prepared for other hazards that are perhaps more likely